Hello, this is Michael Paris, the Health Sciences Librarian for University of the Pacific at the Rite Aid Information Commons. And this module is called EBP, a Pyramid of Evidence, and it is a module in the Evidence-Based Practice series. We will be studying the levels of evidence in the pyramid that you see in the upper corner, left corner. At the end of this session, you will be able to first investigate 6 major types of evidence. 2, we'll be able to differentiate between filtered and unfiltered evidence. And finally, we'll be evaluating websites using the pyramid of evidence in order to assess the quality of information within those websites. The graphic that you'll see of the pyramid is called Levels of Evidence Pyramid, created by Andy Puro, who is located at GWU Himmelfarb Health Science Library, and the graphic was created in September of 2014. What we are speaking about in terms of evidence are different types of evidence. Not all information is created equal, and so we want to make sure we look at the rigor and authority of all the information that comes to us, whether it's from the internet or in journals and magazines and books. So when we are looking at different types of evidence, what we'll do is first start from the bottom up, and we'll make our way up towards the top, which is the best evidence available for any type of information. So at the bottom, we have background information and expert opinion. This information tends to be in textbooks. Expert opinion can be found on websites or blogs. We see expert opinion in terms of doctors who may have a certain opinion or information about a procedure, but it may not necessarily be on the level of a scholarly work. The first major type of evidence that we will come across is the case report or case series. And these forms of evidence are reports of an individual patient. These are very typically can be unique cases, but for the most part, they're detailed reports of the symptoms, the signs, diagnosis, treatments, and follow-ups of an individual patient. Case reports may contain a demographic profile of the patient, but usually describes an unusual or novel occurrence. Our next level of the evidence pyramid is cohort studies and also case control studies. These are observational studies that you'll want to look in terms of, for example, a cohort study is a form of a longitudinal study. Randomized controlled trials, or RCTs as they're abbreviated, you'll probably hear about that very often. What it does is it assesses a variable, such as a drug or a treatment, and the subjects are randomly assigned to a treatment or a control group. And this is done to minimize bias. The RCT is the gold standard for clinical trials. So if you're looking for clinical trials when you do your searches, you'll be looking for RCTs, or randomized controlled trials. My favorites are CATs, which are critically appraised topics. CATs are a short summary of the evidence on a topic of interest, and usually it's focused around a clinical question. So a CAT is like a shorter and less rigorous version of a systematic review, which we'll discuss next. What it does is it summarizes the best available research or evidence on a topic. Now, clinical practice guidelines are in this area, are recommendation of statements that are intended to optimize patient care, and they are informed by systematic review of the evidence, and they're also give an assessment of the benefits and the harms of alternative options. It's almost impossible for practitioners to keep up to date with all the new evidence for their field of clinical study. And all practitioners encounter questions that arise from real life clinical situations. So evidence-based decision-making in a clinical scenario demands time-efficient, up-to-date evidence review. And critically appraised summaries of the best evidence for common clinical or educational questions addresses these needs. The gold standard would be the systematic review, which we will be discussing. But these usually take too much time and effort and are not practical for clinicians to conduct because they tend to take a lot of time and require much searching. So they tend to turn to CATs because CATs will provide information that's up to date as well as a brief summary. Now, individual CATs can be wrong or inaccurate. CATs appear as first drafts without peer review. So these first drafts may contain inferior evidence or errors and interpretation. Also, CATs have a short shelf life. They can be obsolete as soon as newer or better evidence becomes available. So without the constant updating for newer evidence, their clinical bottom line becomes out of date. So good quality CATs specify a date that they're updated. And now we come to systematic review, which is a systematic approach to literature reviews to reduce random errors and bias. Now, they can be published or unpublished, but typically you will find them published in Cochrane database or PubMed. You can definitely use a specific search within the search tool to do that. So systematic review is conducted according to transparent and repeatable process, considering all of the published evidence, not just that of which the reviewer may have prior knowledge or favor towards. By providing a clear, explicit fashion of the summary of all the studies addressing a specific clinical question in the literature, in all the databases. A systematic review allows us to take account of the whole range of relevant findings from research on a particular topic, and not just the results of one or two studies. They can be used to establish whether scientific findings are reliable and generalized across populations. Also, they will discuss treatment variations or whether findings vary significantly between different subgroups of populations. Now, meta-analyses at the very top of the pyramid is a systematic review. It's just that it employs a quantitative method to summarize those results. So often when you go into the literature, you will see the title may say a systematic review and meta-analysis at the end of the title. When you see those two, then you know it's a systematic review with a quantitative method. If it just says meta-analysis, it's basically the same thing. Next, we'll talk about filtered and unfiltered information. First, we'll talk about unfiltered information towards the middle of the pyramid. Unfiltered information is information that has been filtered by others in terms of, unfiltered information has not been filtered by others, and it is in a form of what you might call experiments or trials. Typically, they tend to have, like in a randomized controlled trial, they will have a control group, or there may be a placebo. So you want to think of unfiltered information as basically the experiment. So you have a hypothesis, you test it, you come out in terms of results, and you draw a conclusion. So you are actually the primary means of gathering the data. And this, although cohort studies, case control studies, and case reports don't necessarily have an experimental design. For example, you could use observation, or in the case of a case report, even report on the individual patient's history. In these cases, we are still the primary gatherers of the data. So the information has not been filtered through any other source. It has been determined through methodology by the researcher. So unfiltered information, that middle portion of the pyramid, is basically driven by the researcher. The top part of the pyramid is filtered information. These are the CATs, systematic reviews and meta-analysis. Now the filtered information has actually been filtered through other researchers. So they are taking all the unfiltered information in the middle part of the pyramid, and they are using another method, usually quantitative method, or even qualitative methods, but they're usually using quantitative methods to filter the information to determine what the outcomes are based on using multiple studies by multiple researchers and putting them together. If you remember with the cats, there's just a couple that they may use. 2, 3, perhaps they're going into the literature and just looking at the last few years and finding the best research on one topic in just the last few years. For systematic reviews, they're filtering all the information out there in the literature. They're going through multiple databases. They're combining all of the information into one paper. And what they're doing is providing the typical outcome or what the results are by combining everyone's research on the same topic. And of course, meta-analysis, again, they are using a quantitative method to analyze. If you notice at the bottom, it says TRIP searches filtered and unfiltered information simultaneously. That TRIP is actually a database. It's similar to Google, but it will actually search for the information, and it will only go to evidence to find the answers. So it's a really great database. It's a meta search engine, and I highly recommend that you go to tripdatabase.com and do some searches. But you can actually filter in the menu whether or not you want to find filtered or unfiltered information, or even draw down as far as meta-analyses, systematic reviews, cohort studies. You can choose all those as your evidence you want to look for. So the big question I would have for you is, where are blogs and Wikipedia in this pyramid? Where would you place that information? And I will leave that answer to you. Now it's time to take the quiz. So please go to http pacific.libwizard.com/pyramid of evidence. And I've also included the bibliography. We referred to Evidence-Based Practice for Information Professionals, the handbook by Booth and Bryce. We also looked at the Study Design 101 pages from Himmelfarb Health Sciences Library. And we also reviewed Critically Appraised Topics Introduction by Galvin. Thank you for watching, and I look forward to seeing the results of your quiz. Once again, this is Michael Paris, University of the Pacific Health Sciences Librarian.